we've been paying some close attention to what's been happening internationally as well, in the UK, in the US, and further afield as far as influenza. Influenzas on the tongues of many people. We've heard about many stories here with people not feeling well. There have been some schools reporting an increase in the number of students who are out for reportedly sick. And it could be directly related to this increase that we are seeing. That's why we have the infectious disease specialist, director of clinical and diagnostic services at the Queen Elizabeth Hospital, Dr. the Most Honorable Corey Forde, with us. Good morning.
Good morning. It's good to be here.
Good to have you outside of our hospital to talk about something that we're watching as well, keeping a close eye on as we see an influx into our accident and emergency department. First, set the scene. Talk about the current environment and what we're seeing as far as influenza, a little bit of COVID, and some of the other infectious diseases.
So I think it's
around.
important for the public. So I decided discuss to come on after much discussion. The whole idea of these respiratory illnesses which are going right now is nothing that's new. It's nothing that was not expected at this time of year.
Tis the season.
Exactly. It's the season for influenza. This is the season for any of these viral illnesses, respiratory viral illnesses. Often comes on when it gets a bit cold outside. You know, we'll say, remember back in Canada, we say everybody's bundled up because it's so cold, so people are more indoors, and obviously you'll get more spread of these type of respiratory viruses simply because of that particular purpose, that bundle up situation. So we talk about the flu, for example. Everybody knows influenza, influenza A, there's influenza B, affect humans, seems to be circulating a little bit more. You've seen the warnings coming out from PAHO, and some of the other international agencies. We've seen, certainly, you know, I spoke to the hospital at least 3-4 weeks before because I've been flagged that, you know, we're going to have a little bit of busy season. Some years are busy, some years are not. And I think what people need to understand, this is really an era of personal responsibility and people taking personal responsibility for their health. So how you respond to it depends on your particular scenario, of course. It was important for me to say who are those vulnerable groups, right? So for things like influenza, it's a little bit different than COVID. So for things like influenza, people who are morbidly obese, people who have respiratory illness, we do have a lot of obese people in Barbados, unfortunately. Yeah. You know, people who have respiratory illnesses, people have like chronic obstructive pulmonary disease, for example. These people are at higher risk. Pregnant ladies are also at high risk of getting complications. And then those who have the normal other, what we call a non-communicable disease, put together as an entity, but I've mentioned the most important ones. How is it spread? Of course, it's by respiratory droplets for most part, but on occasions it can be aerosolized depending on what you're doing. So we would often, at this particular interval, advise individuals to be very cautious, especially if you have a respiratory illness and you know that you're both you're at high risk, to make sure that you're keeping up with all the things you're supposed to keep up with. But I just want to stick a pin here and mention one particular part. I think that we really need to drive home, because influenza, COVID, human metapneumovirus, virus, respiratory syncytial virus, or any of the other respiratory viruses, they don't just drop out the sky. So they move with people. And I just wanted to really talk to Barbadians a bit about travel, travel precautions, or travel etiquette.
So what do Barbadians need to do as they travel?
Yeah.
Some are coming back home from the diaspora. Some are heading overseas to many of these areas which are flooded with these influenza cases. What do they need to do? I know mask wearing is always an option. We do it in clinical spaces at the QEH.
Yeah, we still maintain that. I think the travel etiquette is important, and I think a lot of the cases which you're seeing are related to obviously people who've traveled and come back into their household, or people who are coming from overseas back to the family. Everybody's happy to see everybody for the Christmas season, and they bring this home. So what is travel etiquette? If you know you're traveling, know where you're going to, know what the flu risk is there's a big flu risk right now in Europe, plundering a little bit some of the European hospitals. So if you know you're traveling to those areas and you know you're immunocompromised in anywhere, you have any of these things that I've mentioned before, to make sure you travel with your normal medications. Don't travel without your medication. Don't travel without your inhalers. Don't travel those aspects. Airport's a nice place for this to spread. If you know you're high risk, it's up to you. You know your risk pattern. I don't, right? So you wear a mask, in those high risk areas. You think that your risk is high on the plane. You see somebody coughing next to you, might pop off the mask, and you might decide to wear it. So you have to use. I think we're in the era of people taking personal responsibility for their health at every single juncture. If you know your risk is high, and or you're coming back from overseas and you have a respiratory illness, and you have a little granny in the house, a little grandpa in the house, or you have a pregnant lady in the house, or your wife is pregnant, for example, then you don't want to give it to them, because the overall risk of getting severe disease is certainly high. So you might pop a mask on within your house at that particular point, but there's no, it's really voluntary, and people using the common sense. In the hospital, we've taken the position of, in clinical areas, wearing masks, because of course every single Barbadian knows the hospital is a place where you have the most vulnerable persons. So we have to take those measures for our protection. But with that in context as well, we also have seen, certainly within our accident emergency department, over the last 3, 4, 5 days, you would have heard me speak about it every morning on our daily huddle, that we've seen that uptake of people being seen in A&E, but also being admitted in A&E with severe respiratory illness.
Yeah, so before we come to how we handle that, because they're coming into a confined space, we got to make sure that all patients are protected even from each other. I want you to talk about immunization. Is that still a consideration to help you during the flu season?
Yeah, it's always a consideration for people. They're strongly advised, certainly in the health sector, because you're going to interface more with individuals. The flu vaccine is not something that's compulsory again. You know how I feel about these things. It's people's freedom of choice to do that. But it's strongly advised, especially in those high-risk groups that I mentioned before. And I will tell you from a little bit on the inside that certainly from the flu that's circulating and in the current vaccine for a flu vaccine, that there's actually pretty good coverage this year around.
Okay. And then in terms of the internal protocols at the hospital for protecting patients, isolation is a big part of that.
Yeah, so isolation is very important, which sometimes puts me in a little bit of tailspin sometimes. But we need to isolate those patients from other patients to protect the health of other patients. You don't want to come to the hospital for one thing, and then you end up with spread through. So we have very strict infection prevention control protocols in the hospital. I would really want to talk to the visiting public and to speak to us, the staff in the hospital as well. I'll take the opportunity to tell them, to absolutely ensure that they follow the protocols, wear masks where it's required in areas, to please do that at this particular point, so we can stop the spread to our more vulnerable patients.
Yes, and if you are one of those in that vulnerable grouping, it would make sense for you to walk with a mask to protect yourselves. It's optional, yes, but it's better to be safe than to be sorry. As Dr. Forde said, the flu vaccine, also an option. Can you tell the public where they can normally get those flu vaccines?
It's mainly a public health thing, but usually at your polyclinics, you can ask about that.
Okay.
Or your private doctors, of course, can also give them.
As always, thank you, Dr. Forde, for coming and sharing with us this morning some critical information to get you through the season safely and healthy. You really don't want to be bogged down with the flu or with influenza or anything of that sort. You want to be healthy, so just pay attention for your better health. Thank you, Dr. Forde.
Morning, morning, morning. Good morning.